100 years ago, local physicians and community leaders agreed that high-quality health care was important for the residents in this community, and that vision and mission lives today. Achieving and sustaining it really demands the excellence and expertise of the clinicians and their expectations to continue quality health care.
It's always a pleasure to talk about Riverside Medical Group, particularly the physicians and their role, not just clinically, which is significant, but also leading in the clinical arena, as well as what that brings to their patients and then in aggregate to the community. Most clinicians want to be on the top of their game. And in order to do that, not only do you need skills, right, based on your training and your practice over years, but you also need the right technology, the right equipment, the right devices, etc.
Technology has become a much more important part of the neurosciences. It'll always be about the person providing the care, but the truth is technology has become really essential. It's different this year than it was last year. It's usually more expensive this year than it was last year as well, but we are absolutely determined to make certain our patients have access to the leading edge technology that complements our really leading edge physicians, nurses, and team members.
As we look at evolving services within our neurosurgical space, we are looking at a new technology that provides minimally invasive surgical treatment options for ablation therapy. For neurovascular, as we look to continue to grow and evolve our services to meet the outpatient and inpatient demand, we will look at adding a second biplane to our current neuro suite.
So with respect to bringing new technologies, which requires budgeting, this is where philanthropy and foundation work can really accelerate some of these unique technologies.
So there is a neurology shortage in the United States. It's not unique to Riverside and the communities that we serve. Private funding, I believe, supports a lot of the innovation that Riverside sees, and when new technology comes out and we are able to acquisition, this is something that is very attractive for physicians to come to our community.
If philanthropy can support a neuroscience program, then the benefit to patient care is enormous.
But we know, in order for people to be cared for in the way that we would care for those we love, some of that simply has not been and will not be paid by insurances. That's where the philanthropic dollar comes in.
Through private support, our foundation's Make a Difference Fund has supplied, I think in the last year, over $4 million in support to those most in need. And that's how you get great community health. That's what makes a difference in our area.
So as we look at neuroscience evolving, I truly think RN navigation is something that we'll focus on. The oncology service line, they're the ones that pioneered nurse navigation, and we've seen the fruits of that labor and just how beneficial it is for the patients. This is a service that's often not covered by insurance, and it's the right thing to do, and is certainly what we would like to offer our neuroscience patients as well.
We've evolved into a system where physicians are leaders really at every level with dyad administrative partners. That has worked extraordinarily well for us. And the foundation provides resources, again, that are not otherwise going to be there. And so I'm all in, and I think, I hope the rest of my colleagues will be there as well. And I have no doubt they will be, because they have been in the past.
We do have a comprehensive neurosciences service line, which a community health system our size, boy, that's a gem to have. There's a lot of folks who've contributed to this, physicians and others, and what we have at this point, it's pretty phenomenal and continues to expand. We have 14 neurologists, 2 neurointerventionalists, 4 neurohospitalists, 6 neurosurgeons. That's pretty significant. And they're doing really comprehensive work in their respective disciplines that is remarkable.